Many pollution sources can affect the air you breathe, from power plants and vehicles to dust and wildfires. Knowing more about local air quality can help you protect your health. If you're thinking about buying an air sensor, EPA has a series of videos to help you get the most out of it. Learn how EPA collects and uses regulatory data, how EPA communicates health messaging, and how to interpret the readings from your sensor. Visit epa.gov/air-sensor-toolbox.
Hello and welcome to Green Scene, an environmental podcast you can take with you. I'm Anesta Jones of the Office of Public Affairs. Millions of Americans suffer from the serious and sometimes life-threatening respiratory disease called asthma. While May is Asthma Awareness Month, EPA is committed year-round to educating all Americans about asthma so that everyone knows what asthma is, how the environment can affect asthma patients, and how to manage environmental asthma triggers. As part of our efforts, EPA supports organizations that are working to improve the lives of people with asthma. Today joining me is Tracy Mitchell, a registered respiratory therapist and certified asthma educator from our Indoor Environments Division in the Office of Radiation and Indoor Air, and a representative from one of EPA's partners in our asthma awareness efforts, Marcella Gimignani, from the Asthma and Allergy Network, Mothers of Asthmatics, AAA-NMA. Welcome, Tracy and Marcella, to the show.
Thank you.
Thank you for being here today.
Thank you for coming.
So before we start talking about asthma, Marcella, can you tell me a little bit about your organization?
Yes, Allergy and Asthma Network, Mothers of Asthmatics, is a non-profit organization whose mission is to eliminate death and suffering due to asthma, allergy, and related conditions. We have a group of volunteers working with us across the country. We call them outreach service coordinators. And as part of that group, we have the Hispanic outreach service, which include cultural competent educational material and volunteers working with underserved populations. We also work with families and schools and community centers, creating awareness on the disease so people can learn how to prevent and manage asthma.
And Tracy, in addition to supporting nonprofits, what else is EPA doing to promote awareness and to fund this disease?
EPA directly and indirectly through some of our partner organizations is conducting research in primarily 3 areas. To learn more about the genetics of asthma, the genetic component, and why some populations are more affected than others. We're also learning more about things in the environment that trigger asthma and why some things are more of a trigger than others. And then we're also working to learn more about ways to reduce those triggers and what are the most effective ways to reduce people's exposures to things that could cause an asthma episode.
Now let's talk more about asthma itself. What is this disease and what are some common symptoms?
Asthma is a disease of the airways in the lung, and when someone has asthma, their airways become inflamed, red, and swollen, and the lungs produce excess mucus, so it makes it very difficult to breathe. Common symptoms are coughing, wheezing or whistling sound in the chest, and difficulty or shortness of breath. And it can be very scary, especially for a child who's having an asthma episode. It is one of the most chronic diseases in childhood, and so it is a very serious problem in children.
Some of those symptoms we're seeing now because of the flowers being in full bloom. What are some of the differences between asthma and common allergy?
Asthma and allergies are actually very closely related. Many people who have asthma have an allergic asthma, whereas pollens and molds, things in the environment that are seasonal, often can trigger an asthma episode. So along with the watery eyes or the scratchy throat, the itchy nose. People who have allergic asthma also will have the wheezing and the coughing, and sometimes those go hand in hand in about 80% of the cases.
Is there a certain population that is most at risk?
As I mentioned, children are actually the higher risk population, or a higher risk population. Also, Hispanics are at a greater risk, and primarily Puerto Ricans are disproportionately affected by asthma. About 2 million Hispanics in the country, in the United States, have asthma, and so they're definitely impacted more than other populations. And actually, African Americans have a higher hospitalization rate and a higher death rate than other populations, and so they are of a particular concern. And we're working, across all of these populations to help decrease the impact of asthma.
And Marcella, your work with the community and with children, what tends to make asthma worse?
We call them triggers. And there's a lot of things that can set off asthma, and people should be aware of what is their particular trigger. Even though they're different for each people, the most common are dust, mold, furry animals, pests like cockroaches and mice. Secondhand smoke can trigger asthma also, as well as play or exercise, viruses, and air pollution.
Prevention is often key. Is there anything you can do to prevent an attack?
Yes, people with asthma and parents of children with asthma should know that with good care, anyone with asthma can lead a healthy life. The key is work with the doctor or the healthcare professional to develop a treatment plan. This plan is called Asthma Action Plan, and will tell you what medicines to take, when to take them, what to do when asthma symptoms get worse, and how to avoid your triggers. Avoiding triggers is key component of a good asthma management. Also, if the child has asthma, you may want to be sure that anyone who takes care of the kid has a copy of the Asthma Action Plan and understand how to use it.
Are there simple things that parents can do to avoid the triggers?
If we are talking about indoor air quality and asthma management, there's several steps that people can follow. The tips are to keep your house clean, dry, and free of dust. That will prevent mold and pests. Also, if dust mites are set up your asthma, you may want to use allergy-proof cover, and also wash your sheets and blankets weekly with very hot water. And what is very important is never allow nobody to smoke inside your house or in the car or at work.
Is there any other advice we want to give to our viewers?
Yes, I think having an asthma action plan, taking the medicines that your doctor prescribed and try to avoid your triggers is key components for a better asthma management. You can take simple steps to make your home asthma friendly, and you may want to start from your room. And then with small changes, you can have your home healthy for the whole family.
I think I'd just like to say, while asthma can't be cured, we know enough that we can manage it, and that while we are looking and doing the research that we talked about in the sound science, there are things, simple things, as Marcella told us, that parents and that people can do to address asthma right now. And at EPA, we're working through organizations like the Allergy and Asthma Network, Mothers of Asthmatics, and other national partners to educate healthcare providers about comprehensive asthma care and including environmental management, and to really help at the community level to address asthma in communities across the country. So the help is out there, and hopefully people will be able to access that and be able to help their children, especially, breathe easier.
Thank you, Tracy and Marcella, for being here today.
Thank you.
Thanks.
More information about EPA's efforts to reduce exposure to asthma triggers and what you could do to minimize their impact is available at www.epa.gov/asthma. See you next time on Green Scene.
Have you ever had a question about saving energy in your home but didn't know where to turn? Just ask the expert.
Summertime is here, and there are some easy ways to save energy and money. On a hot day, shade can help your home stay cooler. If you have a window where the sun streams in, adjust your curtains or blinds to block the direct sun. An awning is even more effective at blocking that hot summer sun. Another great way to save energy is to use a programmable thermostat to automatically let the temperature rise in your home whenever it works for your family to do so. Raising the temperature just a few degrees during the day and at night can save $180 a year. For more great ways to keep cool, save energy, and fight climate change, visit EnergyStar.gov.
Here's some good news for our country and for future generations. EPA is strengthening the air quality health standard for ground-level ozone, or smog. Less smog means fewer lives lost too soon, fewer asthma attacks, fewer emergency room visits, fewer sick days for working families and school children. We reviewed thousands of scientific studies and set the standard based on what the science tells us is necessary to protect the health of Americans. That means kids, older adults, and people with asthma or other lung diseases can breathe easier. Most U.S. counties that monitor their air will meet the new standard by 2025 as cars and factories cut pollution. Clean air and a healthy environment help to strengthen our economy. Since 1970, our country has worked to cut air pollution by 70%, and at the same time, our economy tripled in size. The bottom line? Stronger ozone standards mean less smog, cleaner air, and a healthier future for generations to come.
Did you know that over 40% of cargo shipments imported into the United States come through the ports of Los Angeles and Long Beach? All of these goods at this warehouse in Carson, California are being inspected by Customs and Border Protection. And as you can see, there are a number of illegal goods. EPA is here today looking for imported vehicles and small engines, trying to figure out if they comply with our environmental laws. We do this important work because cars get smog checked and small engines of vehicles like this don't. The sheer volume of small engines imported into the U.S. produce an enormous amount of polluting emissions relative to their size. We estimated over 500,000 pounds of air pollution would have been generated by the engines seized by EPA in the last 18 months. We regularly inspect leaf blowers, chainsaws, ATVs, and lawnmowers, and many other types of small engines.
So in addition to the exhaust system, part of our inspection includes inspecting the carburetor. There's some of the worst air quality in the country here in California, so it's very important that we look at this carburetor to make sure that the air-fuel mixture is not adjustable.
Some of these engines will stay here in California, but the vast majority are sold across America. So it's important we find the non-compliant engines at the point of entry, because air pollution is a national health issue.
There are some people with asthma. It's extremely important. You need to go to other countries to really appreciate what EPA does.
We do these inspections every month. We look at usually around 10 to 15 shipments, and typically 3 to 5 of the shipments contain illegal vehicles.
All right, here's another shipment we're looking at. This is a scooter. We need to take off this exhaust system here. On 3, 1, 2, 3. All right, and voila.
Inside the bump here should be, if it's legal, a catalyst sprayed with precious metals like platinum, palladium, and rhodium. And sometimes companies don't put them in, sometimes they're straight pipes, which is illegal. This one actually looks like it has a catalyst in it. So what we're gonna do is we're gonna send this to our lab in Richmond, California.
We're supporting the Enforcement Division with a program to look at inspections of off-road vehicles that are being imported to the United States. We take the sample, we take out the catalytic converter, we check a number of aspects of that converter, its size, the precious metal content. We remove the wash coat output from it and we analyze it using X-ray fluorescent spectrophotometer. It's an X-ray gun. We compare the results of our analyses to a spec and determine whether or not they're in compliance with the specifications and the regulations.
When small engines don't pass the exhaust test at our lab, our inspectors share the findings with our attorneys and our team at headquarters recommend that Customs and Border Protection seize the engines. Then we calculate an appropriate fine to resolve the violations with the importer. We're not finding any markings on this outboard engine, which tells us it's a non-compliant engine. Without a label or EPA certificate, we skip testing the exhaust system. Instead, we're advising Customs and Border Protection to seize these goods. Bad air quality is a big problem here in California and in many other areas across the U.S., so this is important work EPA is doing. For more information, please visit our website.